All right. Welcome, everyone from around the state of Massachusetts and from around the country. We thank you so much for joining us today for our event, Managing Celiac and Other Dietary Restrictions Around the Holidays. My name is Polly Mendoza, and I'm the Community Outreach and Volunteer Engagement Director at AARP Massachusetts. And I've partnered today with Carla Carter, who is here from the National Celiac Association to provide this webinar for you. Our event was featured on AARP's Virtual Community Center, so we're really thrilled to have people joining us from so many different places across the country to learn about this important topic. If you celebrated Thanksgiving, I hope you all fared all right managing celiac disease or other food allergies, but I feel confident you'll learn some really helpful information today to prepare for all the December holidays and celebrations that we have coming up. This is our final webinar as part of a caregiving series in honor of November being National Caregiving Month. But you can see all of our webinars on the AARP Massachusetts YouTube channel, and we've got a great website for you, which is our local landing page for all things related to caregiving, and that is www.aarp.org/caregivingma. And we'll put the links in the chat and send you an email afterwards with those links as well. Our national office is providing another caregiving related webinar this week, this Thursday, in fact, which is called How Family Doctors and Caregivers Can Work Together. That will be December 5th at 7 p.m. Eastern Time. You'll also want to bookmark your local AARP state page where we post about our local events, our advocacy wins, and our calls to action. For Massachusetts, that page is www.aarp.org/MA. This webinar, as you can see, is being recorded. And for those that registered for the webinar, you'll get a follow-up email with a survey, the recording link, and all of the resources that we mentioned here today. Before Carla gets started, I just wanted to give an update on what we've been focusing on here at AARP. Across Massachusetts and all the way to Capitol Hill, AARP is leading the fight for issues that matter most to you. We're working to strengthen Medicare, safeguard Social Security benefits, and champion the rights of older Americans. AARP is urging Congress to better support family caregivers, make communities age-friendly, and crack down on fraud. Thanks to our millions of members, we are winning the fight. In a historic victory, AARP led the charge for a new Medicare prescription drug reform. Starting this January 1st, a new $2,000 cap on prescription drug costs will take effect, saving Medicare enrollees who reach the cap an average of $1,100 a year. Additionally, for the first time, Medicare will have the authority to negotiate lower prices on select high-cost medications, an enormous step forward for affordable health care. And this is all great news for older Americans. Now, without any further ado, I'd like to introduce our guest speaker, Carla Carter. Carla is the Director of Outreach and Programming with the National Celiac Association. She herself was diagnosed with celiac disease over 2 decades ago while completing her Bachelor's of Science in Occupational Therapy from the University of New Hampshire. She worked for over 15 years in the clinical setting, treating adults and seniors with diverse medical diagnoses, specializing in neurology, specifically Parkinson's disease and stroke recovery. Carla transitioned to working at NCA, National Celiac Association, in 2017, where, among other things, she oversees the development and running of the organization's programs, including supporting celiac seniors, raising our celiac kids, feeding gluten-free, and their extensive national support network. As you think of questions you want to ask Carla today, please put them in the Q&A section. So not the chat, but put them in the Q&A, and we will get to as many of the questions as we can before the hour is up. So now, Carla, I will hand it over to you and take myself off of the screen so you can share the presentation.
Thank you so much, Polly. What a great welcome. And I am going to share my screen now. Hopefully everyone can see that okay. So yes, Polly, thank you so much for the wonderful welcome, as well as to AARP of Massachusetts and National for this great collaboration. As mentioned, I'm an occupational therapist. I am the Director of Outreach and Programming with the National Celiac Association and a person with celiac disease. Our daughter is 12 and she was diagnosed at the age of 2. And we have I have two siblings. So there's four of us in our family. I am a caregiver. And so I hope to be able to offer some good insight and information to you today. All right. So just a couple of housekeeping tips. As Polly mentioned, the Q&A feature used at the bottom is for general questions that we will try to get to as many as possible. We are not able to give medical advice, so definitely try to keep those questions as general as possible. And then again, pertinent links will be emailed with the recording of this after the webinar today. So, okay, I know we talked about holidays in the title and being a guest and a caregiver and a host. I know there are a lot of emotions that may come up around the holidays, whether you are a guest or a host, sometimes filled with fear or anxiety and not knowing what to do, how to act, what to say. But hopefully after today's webinar, you'll feel a little more confident moving forward and know that it can be easy and fun to be a caregiver or to have somebody at your house with a food adverse reaction. So just a little bit about what we will go through today. We find it really helpful to understand the basics of a disease or an intolerance. So using gluten or wheat as the main discussion point, I will discuss what celiac disease is, what food intolerances are, and food allergy. So once we understand that, I'll also try to explain what gluten actually is and what is all the talk about the gluten-free diet. We'll touch a little bit on being a guest and a host, and then hopefully I'll be able to offer you a lot of support and resources from NCA. So celiac disease itself, let's dive right in. Celiac disease is a genetic disease. It's autoimmune in nature, which means the body attacks itself. So with rheumatoid arthritis, that's another autoimmune disease, the body attacks itself in the joints. With celiac disease, it mainly affects the gastrointestinal tract. So when somebody with celiac disease eats gluten, the lining of the small intestine becomes damaged and people aren't able to absorb nutrients properly. So this can lead to deficiencies and other serious health complications. Celiac disease affects about 1 in 100 people, so about 1% of the population. And just a small fact, this is a very brief slide. So there's so much more to talk about with celiac disease, but I want to keep it brief for you today. There is a skin manifestation of celiac disease called dermatitis herpetiformis. And so just wanted to share that that's also part of the disease. And just a picture here, this is the small intestine. And the middle picture here is a zoomed in picture of the lining of the small intestine. And there are finger-like projections called villi. And what they do is they increase the surface area of the small intestine to be able to absorb as much as possible from a nutrient perspective. And you can see they're nice and tall in someone without active celiac disease. But over to the far right, someone who has active celiac disease, those villi are very blunted, and there's usually a lot of inflammation. And that can be patchy throughout the lining of the small intestine in multiple different places. Symptoms of celiac disease vary so much. You don't have to have any symptoms at all, or you can have any number of 200 or more possible symptoms. Hopefully not that many, but they do vary so much. Gastrointestinal symptoms used to be the typical symptoms that people would have, like diarrhea, constipation, cramps, reflux, nausea, and vomiting. You can see all of them listed there. But actually more than 50% of adults have these non-gastrointestinal symptoms, such as fatigue, depression, anxiety, joint pain, and muscle aches, peripheral neuropathies, which is numbness and tingling in the hands and feet, all the way to infertility and headaches and dental abnormalities. And then there's the malabsorptive related symptoms, such as iron deficiency anemia. It's one of the most common vitamin deficiencies. A lot of important information about bone health. A lot of people have osteopenia or osteoporosis related to malabsorption, and weight loss and failure to thrive. And at the bottom of our website, we have this really cool signs and symptoms and related conditions chart. This is not all encompassing. But at nationalceliac.org, you scroll to the bottom and you hover over any one of these dots here, and it kind of highlights some of the other potential symptoms. Okay, so that was a very, very brief discussion about what celiac disease is. So then people often wonder, is it different than an intolerance? And so we will touch on non-celiac gluten sensitivity. You can have an intolerance to almost anything. So NCGS is an intolerance to gluten, and there are similar symptoms to celiac disease, but there is minimal to no damage in the lining of the small intestine. It affects about 6% of the population. And just to let you know, there is no biomarker for NCGS, which means there's no test to accurately diagnose it. A diagnosis of NCGS can only be made after celiac disease and wheat allergy have been ruled out. And eliminating gluten is the only treatment for NCGS. Wheat allergy. So this third piece of a food adverse reaction, an allergy is actually a different part of the immune system than celiac disease. It's IgE mediated, which if you go to an allergist, they can talk to you all about that. So it's a different branch of the immune system. And so when somebody ingests wheat, their symptoms may vary and can be mild to anaphylactic. I'm sure you've heard of anaphylaxis. It's a life-threatening reaction. It can happen in the skin, mouth, lungs, and/or GI system. And usually an allergist will diagnose this. And a wheat-free diet is the treatment. And medications can also be helpful to manage the symptoms. So we talked a little bit about diagnosing NCGS and wheat allergy, and a little bit more about diagnosing celiac disease. Blood test is kind of the first step to check for antibodies associated with celiac disease. The most common is tissue transglutaminase, or TTG, but it's really important that the doctor orders a total IgA, because some people are deficient in IgA, which if they are, it's going to throw off the TTG blood work or the level. So those are a couple of things that need to be ordered via blood test. Some other things are called an EMA or a DGP, specifically used for patients with an IgA deficiency. After that, if that is positive, or if a discussion happens with the gastroenterologist about what the next steps are, it's usually an endoscopy with a biopsy of the small intestinal lining. That is considered the gold standard for diagnosing celiac disease in the United States. So what happens is they put a camera down your throat, and they're visually looking for damage or inflammation in the lining of the small intestine. And then they'll take little samples, little snippets from the small intestinal lining, especially from the duodenum. Now, this bit in red right here is really important. It's so important not to start a gluten-free diet before the full diagnostic process. It's really, really important, because that blood work or biopsy could be inconclusive if you do go on a gluten-free diet ahead of time. Okay. Screening family members. It is really important that all family members, first degree, are notified and screened for celiac disease. The rate is higher. It's a higher risk for individuals who have family members with celiac disease. The frequency varies between 3 and 5 years, but obviously if people are symptomatic, they should be screened immediately. And what that screening process involves is the blood test that we talked about. You can also do a genetic test for celiac disease. The two associated genes are HLA-DQ2 and HLA-DQ8. But please note that genetic testing can only rule out celiac disease. It can't be used as a diagnostic test. There are about a third of the population, or between 4 and 5% of the population, who has, it's about a third of the population have one of the celiac genes, pardon me, but only about 5% of that group will go on to develop the disease. So there's a lot of people walking around with one of these genes, but they never go on to develop the disease. And science is still trying to learn why that happens, but at any rate, so again, a genetic test cannot be used to diagnose someone. All right. Hopefully you guys are still with me. We're going to talk about the treatment. The treatment for celiac disease is a gluten-free diet. It is the only approved treatment. And so they are in various stages of research to look for alternative treatments, but there we are. And so as a caregiver, let's do a little bit more understanding of what gluten is. Gluten is a protein. It can be found in wheat, barley, and rye. And what it does is it lends that structure and elasticity to baked goods. So you may find that a lot of gluten-free products tend to be a little bit more crumbly, but they're working on, a lot of companies are working on really good recipes. So there are a lot of naturally gluten-free foods. It can be pretty intimidating when you think of all the things that contain wheat, barley, or rye, because there's a, I'll tell you in a moment, they do hide in various locations, but the naturally gluten-free foods, if they're fresh and plain, fruits and vegetables, meat, fish, eggs and poultry, milk, cheese, rice, potatoes, beans and legumes, nuts and seeds. Just make note they need to be labeled gluten-free. And if they're not in their natural state or if they're processed, you want to definitely check the ingredient label. And beans and legumes should be picked through and rinsed regardless of this gluten-free statement. And a lot of gluten-free grains and starches. As you can see, there's a lot of them, and the blue ones are a bit more of the healthier grains with more fiber and nutrients. Something important to note that any of these, with the exception of rice, need to be labeled gluten-free. We'll talk a moment about cross-contact and what that means. But when there's a lot of contact in the field and on the trucks and how grains are processed. So if some of these items don't have a gluten-free label, they could contain small amounts of gluten content. So gluten-containing grains, here are all the various words for wheat, barley, and rye of things you might see on a label. And then other potential sources of gluten that you might not think of. I mentioned briefly that it kind of hides. A lot of processed foods contain gluten. Some medications, vitamins and mineral supplements have wheat starch or other things, but not a lot, but they still need to be checked. Seasonings and spice mixes. Soy sauce most often has wheat in it, but a lot of other sauces do as well. Smoke flavoring, soups and soup bases, imitation seafood and imitation bacon, yeast extract or autolyzed yeast extract, brown rice syrup, French fries and fried foods. If you can't share a fryolator with gluten-containing food and gluten-free food, because there is a high transfer of that gluten protein. Hopefully you guys are still with me. Bit about alcohol. I know a lot of people have that at their holiday celebrations. There are a lot of gluten-free alcoholic options, wines, gluten-free ciders. Distilled spirits, the distillation process actually separates gluten from the end product. So regardless of the starter grain, distilled spirits are fine for someone with celiac disease. Gluten-free beers, kind of the opposite of distilled spirits. The beginning, if you see there's some gluten-removed beers or gluten-reduced beers, those are not recommended for people with celiac disease because the starter grains are gluten-containing and it's not the same process as the distillation process. So, but there are a lot of good regular gluten-free beers that have a starter grain that's gluten-free. The no's for alcohol, malt beverages, beers, ales and lagers, maybes, mixers, spiked seltzers, wine coolers, or hard lemonade. A lot of them do have gluten-containing grains as well. Okay, I mentioned cross-contact. So someone with celiac disease needs to have a little bit more vigilance or awareness because we have to avoid gluten down to about a crumb level. So cross-contact is actually the term used for when one food comes into contact with another. So we really have to be careful of where there might be gluten-containing crumbs, and we have to think about that on tables and counters, in shared toasters. Cooking utensils or other things such as cutting boards that haven't been cleaned properly or have been shared between foods. Pots and pans that are damaged or not cleaned properly. Spreads and condiments, we recommend squeezables because so often there are those double dippers, and I know we all do it, but if there are gluten-containing grains in there, we just need to use a new fresh tub, or like I mentioned, the squeezables. And then baking with regular flour at the same time as preparing gluten-free foods is not recommended. It does take a while for gluten flour to settle in the air. So those are just some basic examples of cross-contact. And moving on a little bit, I hope you're still with me here. Thinking about lifestyle changes when someone gets diagnosed, or if you're caring for someone in your home, or again, having that guest over, just take a step back for a second. When somebody gets this diagnosis, usually they've been sick, they've sought medical help, and if they're lucky to get an actual answer, theoretically, they should go on the gluten-free diet and all is well. And that's the tip of this iceberg here, what we think about. But if you're that person living with it every day, there is a much bigger base to that iceberg that people have to think about and contend with. Some of the things mentioned here on the left, barriers to diagnosis. A lot of times it takes on average between 8 and 11 years for people to get a diagnosis, whether that's due to access to healthcare or clinicians being uneducated and not diagnosing properly. It really does can take a long time. For some people, they have delayed healing time. There can be complications. I mentioned vigilance, which is required for someone who has celiac disease, but then there's hypervigilance, where it actually causes a lot of anxiety, social isolation, and it impairs their function a bit. There is an economic burden to having to eat a gluten-free diet. About 1 in 6 people with celiac disease are food insecure, and the diet is more than 183% more expensive than gluten-containing foods. So you can see that it's just not the easiest thing to do. And a couple of things on the right side: a high treatment burden, psychosocial impacts, disruption of work and school, and there are some nutritional challenges of the gluten-free diet. So just have that perspective a little bit. When someone is living with a food adverse reaction or celiac disease, food is everything in our culture, and food is life, food is medicine. And so there's a lot more that goes into this huge life change. Okay, so let's move on to being a guest. I know there are a lot of you on here from around the country who have celiac disease or a food adverse reaction, and it can be really scary leaving your house and going to somebody else's house. So we have a lot more tips on our website and other resources, which I'll share at the end. But a couple of suggestions to make celebrations easier, especially as Polly mentioned, we're heading into December where a lot of holidays happen. Communication is number one. You'll hear this again and again. You want to communicate with the host if it's possible to find out what's being served. Let them know about your needs for a gluten-free diet or if you have a food allergy. You want to ask about ingredients and prep methods, some of the things that I already talked about. You could offer to help the host with cooking, or even better, bring a gluten-free dish to share. Potlucks are great this way. It guarantees that you have definitely one thing to eat. Just be aware of buffets, because there can be a lot of cross contact between dishes and whatnot with the spoons. So those are just a couple of tips about being a guest. Now, if you're a host or a caregiver, again, communication and planning are essential. You want to talk to your guest who needs gluten-free food before an event. If you happen to be living with someone that you are a caregiver for, communication about sharing a kitchen is really important. For that guest who's coming for a celebration, you want to ask what their favorite brands are. What do they feel comfortable with, or what steps do they want you to take to help them be more comfortable at your celebration? What foods do they want you to avoid? And ask them, do you want to bring a dish? And so those can all be really helpful. Couple of more things to go over. As a host, just a couple of tips and tidbits. You want to prepare gluten-free foods away from gluten-containing foods, whether that's on a separate shelf or a kitchen island, or if you have to maybe prepare gluten-free foods before gluten-containing foods. Use those clean, undamaged pots, pans, and utensils. Colanders can be kind of tricky because there are so many holes and kind of pitfalls for food getting stuck in them. So you want to use a separate colander if possible. Aluminum foil can be your best friend when you're cooking on a toaster or a grill. It provides a nice barrier between what's on that grill because, contrary to what some people think, gluten does not actually get killed. It's not a bacteria with high heat. So aluminum foil can be really helpful. Use those newly opened condiments, separate utensils for serving, clearly label items, and then be careful about stuffing. So if you are cooking a big roast or bird, then you don't want to use regular stuffing, use a gluten-free stuffing. A lot of those recipes for beer can chicken, don't use the beer, that your guests will not be able to eat it. So I mentioned labeling things. I'll just give you one example. We just had Thanksgiving last week in our family, and there's 4 of us who have celiac disease. On average, there's about 30 people who come for Thanksgiving. So what we've done is it is a buffet, but everything is clearly labeled. And we announced to the group that the people with celiac disease get their food first. And there is kind of like a barrier between gluten-free and gluten-containing. And so that's how we do it in our family. So those are just some suggestions. And just be careful with appetizers. This last bullet point here of shared plates between crackers and cheese. Maybe even put out gluten-free crackers or an allergen-friendly cracker. That's so easy to do. There are so many great options these days. All right, we're already almost done, everyone. So thanks so much for sticking with me. Support and resources. Please know you're not alone. We literally exist to help people through with celiac disease or NCGS. We are the voice of the gluten-free community. So many of you are on here who I know. I saw some names that I'm familiar with in the attendance today. So I'm really excited to see you there. And just know that we have chapters and meetup groups and individual people around the United States on our map online who you could reach out to for local help. We also have, as mentioned in the beginning, a pediatric program raising our celiac kids, and of course, supporting celiac seniors, which is part of the program and the collaboration with AARP today. And lastly, we do have a gluten-free food assistance program called Feeding Gluten-Free, which helps individuals to educate individuals on budget-friendly options, as well as getting gluten-free food in food banks and pantries around the United States. We pride ourselves on offering science-based information. There is a lot of information out there that exists that's questionable in its source. And we know the gluten-free diet has been a trendy term. And so just know that we try to provide as much information as possible based on what science knows at the moment. So our website, which was recently renovated in June, is more enhanced for a user-friendly experience. We have a map to find a doctor or a dietitian. Our FAQs house hundreds of answers to burning questions that people have. We have a restaurant locator and a recipe search. There's a lot of great information there. We do online webinars, and tomorrow, actually, I'll mention this in the next slide. We also have a free monthly e-newsletter, PDF download for free, the complete guide to gluten-free living, and a gluten-free nation print magazine. So there's a lot to offer on our website. Like I said, you're not alone. We have a lot of resources. In addition, we do have one of our recorded webinars that we did last November about anxiety before your holiday celebration. I thought I'd mention that specifically. And the link to that is there, and we will include that in the follow-up email. Our YouTube channel has some great short videos to talk about how to deal with a shared kitchen, or how to be a guest, or what to do to call a restaurant beforehand. And definitely check us out on social media. Our handle is at National Celiac. I'm almost done. Some upcoming events that we have this month. Tomorrow is our collaborative webinar series with the Harvard Medical School Celiac Education and Research Program. The topic is, I'm diagnosed, now what? Tracking progress and monitoring the patient with celiac disease. CMEs for certain clinicians are offered if you attend the live event, and it's 1 hour, so that's tomorrow. On the 12th of December is our Rock Virtual Holiday Bingo for elementary age kiddos. And on 12/17, we just have a fun NCA holiday open house. Just join us very casually, bring your favorite recipe for the holidays, and share just casual conversation. So we're looking forward to seeing some of you for some of these events. Key takeaways, just remember, communication and planning are essential, whether you are caring for someone who lives in your house, whose house you go to, or if you're hosting a party. Offering safe gluten-free options can be easy and fun. Just keep in mind you have resources at your fingertips, especially in our website. And here's some more information to contact us if you would like. Thank you very much. Our references. So I will end there.
Great. Thank you so much, Carla. I'm going to put my video back on. There we go. And we have a lot of questions for you, so I hope you're ready.
Okay. Yes, I will do my best.
That was wonderful, though, really informative. I learned a lot myself. So I'm going to start. I actually got one question in the chat, but for reference, people, if you have questions, please put them in the Q&A. We do have quite a few in the Q&A that I'll get to next as well, but questions can go there. So the first one is, do I have to worry about making gluten-free cookies after baking regular bread in my oven?
You wouldn't want to do them at the same time. And definitely keep in mind the convection setting, because convection blows stuff around. So if you've had that on recently, you wouldn't want to cook them, just after. Otherwise, you should be fine. So not at the same time and not with the convection setting. I can put a link, have my trusty pen here. I'm going to just keep in mind some of these questions. I will put some of our Ask the Experts FAQ answers to those in the email for follow-up, because our experts do a really great job of putting references and answering these questions more thoroughly.
Great. Thank you.
You're welcome.
And we have in the Q&A, how early in life can a person be tested for celiac disease?
Great question. Typically, those antibody levels don't show up before the age of 2. And so they definitely don't usually test before the age of 2. However, having said that, there are a lot of children who are very sick and are diagnosed around 18 months or younger than the age of 2. And so they would have to go through more of the diagnostic process with their care team to find that out.
Okay, thanks. Then we have, what are a few of the dental abnormalities? If you have examples of them, yeah.
Yeah, so we actually had a dentist answer this question recently. So dental enamel defects are one of the most common, but you can have canker sores, open mouth sores, and a couple of other things. We recently went to the International Celiac Disease Symposium, and there was this whole talk on dentistry, and so it was very informative, but I'm happy to put more about dental abnormalities in the link.
Great. Wonderful. Thank you. Then we have from Amanda, could blood work come back negative for celiac disease at one point, but positive in the future if tested again?
Yes. So remember, so a third of the population have the genes, and science and we don't understand yet what turns those genes on. So you could, you know, I think I'll answer this in two parts. I think the blood work is most often very reliable and valid. So if you have active celiac disease and that some of the blood work says no, you don't have it, it is possible that you still have it and you want to talk about everything with your doctor, including your symptoms, your family history, and they may still want to move forward with that upper endoscopy and biopsy. So that is if you have active celiac disease and a negative blood work. If you don't have active celiac disease, yes, you may your blood work's going to be negative. I know someone who's diagnosed at the age of 90, and we don't know how long he had active celiac disease, but theoretically he went most of his life, theoretically, right? Not having active celiac disease or positive blood work. I hope
Okay,
that answers that question.
great. Then we have, can oat flour be substituted for almond flour? This person has an almond allergy as well.
I do too.
Mm,
Um, yeah, so oats are a tricky topic for gluten sensitivity or celiac disease, especially. If you are using oat flour, you really, really, really want to make sure that it is a gluten-free oat flour, if we're talking about celiac. Additionally, that they're doing adequate testing because oats are highly contaminated or come into contact with gluten. So I don't know of the exact ratio from a baking scientific perspective for replacing that flour, but I'm sure that there's somebody out there who's done the ratio analysis for what you would need to use. But yeah, so just be careful of oat flour and gluten-free labeling and what you're replacing them with.
great. Got more and more questions coming in here.
Bring it on,
If
bring it on.
if something is labeled gluten-free, but yeast extract, or wheat is listed as an ingredient, is it still okay to eat?
Okay, labeled gluten-free and has wheat in it. Is that what?
It, yeah, it says if the label says gluten-free, but the label also says it has yeast extract, or wheat are listed as ingredients.
So I'm going to start with yeast extract. If it's labeled gluten-free, then it needs to comply with FDA regulations for something being gluten-free. And the yeast extract that should not contain gluten. Having said that, it'd be still beneficial to call the manufacturer to know their source of yeast extract and whether or not that's a gluten, if it's coming from a gluten containing grain. If it is, it's not allowed to have that gluten-free label. If it has wheat in it, it should not have a gluten-free label either. The caveat there, labeling, it's very complicated, you guys. So bear with me. There is a wheat starch that has been rendered gluten-free, and that is allowed on a product labeled gluten-free in the United States, with another caveat that has to be stated at the bottom that says this wheat has been rendered to be less than 20 parts per million, or whatever the FDA statement says. But I'll put that in for tomorrow as well, because like I said, it can be complicated, and I don't know if I did it justice.
Yeah, great. Okay, so then we have, can a person get sick by skin contact with gluten, or does it have to be ingested to make someone sick?
Excellent question. So the gluten protein is too big to fit through the membrane of the skin. If somebody's got a gaping wound, then yes, theoretically it could go into the under the lining and into the bloodstream that way, but gluten cannot penetrate the skin. So unless you have a different type of allergy, it wouldn't be celiac related. Basically, if someone is having a reaction to contact. So
Okay,
that's what science knows.
And then how much gluten should I have before and endoscopy, and how long before?
Oh, the gluten challenge. I will. It's not a set standard. It would depend on very close conversations with your clinician and care team. Don't quote me on this, but it's usually between 4 to 6 weeks, at least 1 to 2 pieces of bread a day.
Mm,
But it we have an Ask the Expert that talks about it more in depth, that I'll include to help answer this question. A lot of clinicians, if you went off of gluten for a month or a couple of weeks, that's a consideration that your doctor is going to take in from your conversations as far as how much of a gluten challenge you'll need to go through. So again, it's usually a case by case basis, and a lot of people just cannot tolerate a gluten challenge because they get so sick. So again, I'll send that Ask the Expert. So if you ask this question, make sure to open the email for more specifics on that.
great. Thank you. And then is there an app that you'd recommend that accurately scans food products and displays gluten-free status? The one this person's used, GF Scanner, is frequently inaccurate. So for example, it will say gluten-free for a product that has wheat listed in the ingredients.
Yeah, we don't recommend one app over another. The overall umbrella thought process is these things can be tools in your toolbox, or they can be tools to help family members understand or streamline a grocery shopping trip. But your biggest tool in your toolbox is knowing how to read a label, because apps are not updated on a regular basis. And that's just across the board for all apps. So again, they might be helpful and take some of the burden away from the initial thought process, but you always really want to look at that gluten-free label. And when in doubt, call the manufacturer. So
Great. Where could I go to learn more about gluten intolerance and fertility issues? I'm hosting my daughter who is now gluten-free because of PCOS.
um, there's several studies about fertility and celiac disease. I don't know about regular gluten intolerance. Um, so if she wants to look up celiac disease and fertility or infertility, there's some great studies about it.
Okay.
I would recommend that.
Okay. Perfect. Okay. Then we have, is there a reputable place to see which medications are gluten-free?
Yes,
Reputable, sorry.
that's okay. Well, so a lot of medications, this is twofold, prescription versus over the counter. Um, the NIH has a website called Daily Med, and the best thing to do is to search. I'll put that in Daily Med website. Is to search the name of your medication and be specific about the brand, and then it'll list the active and inactive ingredients. And so from that, you can determine what might contain gluten. A lot of them will not be labeled gluten-free, and so you want to talk with the pharmacist too. They might be able to get you the package insert to look at that list of inactive ingredients. So that Daily Med website would be the best. And then over the counter, a lot of generic brands, and I'll just say like Target or BJ's. I'm not advocating or endorsing one versus the other, but some of them will have a gluten-free label for like their Tylenol or ibuprofen. So there's a lot of options that way.
Okay, great. I'm not sure if I'm going to pronounce this one right, but would dermatitis herpetiformis only be evident or active if gluten was ingested? And can this skin condition still be active if a gluten-free diet is being adhered to?
Very good question. So you almost got it right. Very close. It's a hard
Okay,
one. Dermatitis herpetiformis.
herpetiformis. Okay.
Perfect. um, so what was the first part of that question? I'm sorry.
Yes. So would it only be evident slash active if gluten was ingested?
So the skin manifestation can take time to recover. I know just anecdotally, so from people's stories, that it can take a while for that to resolve, but it does get worse with gluten exposure. So a dermatologist can help with those topical medications to help manage the symptoms. Theoretically, it should improve once on a gluten-free diet.
Okay.
And it's really helpful and important to work with a registered dietitian who is knowledgeable about a gluten-free diet and celiac disease. They can often help you food journal or figure out if you are accidentally ingesting gluten some way. So
And that was the second part of the question is would the condition still be active if they were following a gluten-free diet? So, okay, that's
hopefully not, but
yeah,
it is
yeah,
possible.
yeah. Okay, and then this is the last one we have. You've answered 13 questions so far, which is
Wow.
amazing. I know. So once you are diagnosed with celiac, do you ever need to be tested for celiac again? This person was diagnosed with a blood test 12 years ago.
So once you're diagnosed, you have it for life. It is really important to get tested with an endoscopy as well to make sure that you have a good baseline to know how the lining of your small intestine, started out, and then, doctors can compare it if in the future you're not feeling great. But and follow up is really, really important. That's the big discussion tomorrow. If you're able to tune in or just register so you can get the recording, although all the recordings are on our website. But follow up care is really, really important to make sure that you are able to absorb nutrients properly. And then, you need a bone density test when you're first diagnosed with celiac disease to make sure you're checking on your bone health. Thyroid dysfunction, there are other autoimmune conditions to think about. So it's really, really important to have good follow-up care and talk with a clinician who's knowledgeable, hopefully, about celiac disease.
Great. And we did have another question pop up while you were talking. So, can peripheral neuropathy improve or resolve with a gluten-free diet if the neuropathy was caused by celiac disease?
In a lot of people, it does improve. But not 100% in everyone. I don't know the statistic, but there are some people who do struggle with that nerve pain or that numbness, tingling, and it can affect other areas of your body outside of your hands and feet. But for the most part, it can resolve. But the nerves can be tricky as far as healing time and depending on how long the damage has been done for.
Great. I don't see any other questions, but that was really, really helpful. And just as a reminder to everybody, oh, we got one more that popped in here.
Sure.
Um, is it possible to get Graves' disease due to having celiac disease? Question mark, and then it says thyroid.
Uh, so you are at risk for other autoimmune conditions when you have celiac disease, or there's a high association with type 1 diabetes and celiac disease. I'll put in the link to a webinar we did in the past about other autoimmune conditions related to celiac disease. So I would definitely watch that, and look up some of those clinical studies about Graves' disease and celiac disease.
Great. Wonderful. And as a reminder, all the resources will be sent to everybody along with the recording, so that you can watch it again and get down all the resources that Carla has shared with everybody, which was so helpful. And I will do a little plug for National Celiac Association. Today is Giving Tuesday. And so if you are inspired by what they're doing and helping so many people across the country, and I'm sure in other countries as well, I would encourage you to give to them and give to any nonprofit organization. Today is their big day for fundraising so that they can carry on the important work that nonprofits are doing all throughout the year. So,
Thank you,
yeah.
Polly.
Yeah, of course, of
We
course.
appreciate it.
Yeah, no, it's so important. But thank you all for attending and happy holidays to you all. I hope this has made everybody's holidays a little bit more manageable with this information. So thank you, Carla, too, for all that you've done to share this and have a great holiday.
Thank you. You too. Have a good
Yeah.
one, everyone.
Take care, everybody.
Take care.